Hello and welcome to Recordings of the Heart Hospital. This morning I've got with me Dr. Laurence Nunn. Laurence has just come to the end of a period of research at the Heart Hospital, and I'm just going to ask him to tell us a little bit about what it was like to be a research fellow here at the Heart Hospital. Laurence, thanks for joining us.
No problem.
How long have you been at the Heart Hospital now?
I've been at the Heart Hospital for probably about 4 years, clinical registrar initially for about 1.5 years, and then I've just come to the end of a 2-year period of research.
And is that leading to an MD degree?
It is, yes.
And what's your area of interest?
Sudden arrhythmic death, particularly causes and diagnostic testing, screening families of people that have died suddenly of an unexpected cause and likely to have been a genetic inherited cardiovascular condition.
Sounds a very exciting area, one with a lot of emotion attached to it.
Definitely, yes. So you're dealing with families, people of all ages. We see a lot of first-degree relatives, plus also out to further second and third-degree relatives, and people have often lost a very young person, either it's a child or even someone in their 20s or 30s, unexpectedly, very suddenly, without any warning. These are people who are well and have no warning of being unwell. And there is very tragic stories, very commonly, and you're dealing with people that haven't got a reason for why their loved one died. They're searching for answers, but also worried that their other children, and particularly, or if any others in the family has inherited the same condition, could also be at risk. So it can be very emotional, but also be quite rewarding in certain circumstances.
I'm sure. Why did you decide to do research? You were in the middle of an excellent training scheme and you really had to make a commitment yourself of financial and time limits, that was different to going through the standard training. So why was it a good idea to come and do some research?
Honestly, the reason I did research initially was because it was sort of an accepted career path that in doing sort of subspecialty training like electrophysiology, that you had to spend some time in research to be able to progress through the training program, and to become a consultant you had to have done that sort of extra period of training. So I will be very honest and say that it was really because I had to, but in the time that I've spent doing it, I've found an extremely rewarding experience. I've had the opportunity to meet people that I wouldn't have met before, to do things that I wouldn't have done before. Certain areas, the work I do is clinical based research, so I've still kept my contact with patients, which is very important to me. I probably haven't really got the skill set to do a basic science project, and would miss the contact with patients too much to be able to take that kind of time out of my training. But I've done a clinical project which has been excellent to keep, as I say, keep the contact with patients, to be able to research an area into such depth, to become, to understand everything completely about what is known about that area, and then importantly what isn't known, try and take that forward and improve our knowledge in that area, and then be able to translate that to benefits to patients later on. I've been able to present at major meetings, international meetings, met some of the leaders in the field of this in cardiology and particularly electrophysiology. So putting sort of faces to names that you see very regularly in papers is very interesting. Actually be able to meet them and talk to them about their conditions and their experiences.
So would you recommend research as part of the training? And would you recommend it here at the Heart Hospital too?
Yes, I would. It's something you have to think about. It's 2 years, 3 years if you're doing a PhD. There is certainly a financial aspect to it as well. But from what I've learned in the experiences that I've had, I would recommend it without hesitation. The other aspects of it, I've been involved in writing papers submitted to significant journals, but I've also seen the other side of it, seeing how papers are reviewed, how the process of accepting a paper and the revisions that have to go through as well. So I've got a greater understanding as well of what appears in a journal and how it's got there as well, and so my critical appraisal skills are better as well. So I think it's really enhanced me in a number of ways that I probably didn't realise initially.
One more thing to ask about, if patients were coming to the Heart Hospital and hear that they might be involved in research, how would you sort of reassure them about what research means? Because some of them might think that they're sort of humanised laboratory rats.
Sure. No, indeed. It's you've got to be very careful, and especially doing it's a clinical project. Yes, we're very mindful that these are patients, these are human beings, and someone's mother, someone's wife, someone's son. You can't just do something because you think it's interesting yourself and find out what happens to these people. Obviously, we reassure people that every project that we do in any research is put through an ethics committee, and ethics committees are largely based upon lay members and have only people within the field-specific field are actually a small number within the committee, so we're really trying to protect patients' interests. We also tell patients very carefully about the projects, about the different aspects of it, and they may be in a sort of a normal treatment arm anyway and not actually be part of the research per se. We also state very carefully and make it very clear to them that if they don't want to be part of the research, that will in no way affect their level of care. But equally, we also say to them that there's opportunity that this may actually be better for them, and they may be getting better than standard care if this does pan out to be, you know, what we believe and if our research hypothesis is correct. So we try to present it in a very balanced and very fair view, and patients' experiences are sort of, I think they're certainly very much coloured by their experiences they've had in the past. So one or two people who've had relatives that have had maybe a bad experience in hospital for whatever reason tend to sort of shy away from it, whereas others who have had maybe bad things happen to relatives and have had such benefit from being in hospital, or have felt that they themselves have benefited from people in hospital, from time in hospital. People have, you know, they've had conditions diagnosed, have been treated well, want to give something back, and are very happy to be involved in research. So we do see a sort of variety of aspects to it. But
I suppose it also means that coming to the Heart Hospital, the patients can be sure that they are going to get what is really up-to-date, cutting-edge treatment, as well as diagnostic strategies
yes.
there.
That we're at the forefront, and that can be a benefit to them, definitely.
That's great. Thank you very much.
No problem.